guys, we're gonna look at the knee today. It is a very large joint and complex. Remember, this joint takes the brunt of all our weight-bearing load, which is why it tends to wear down over the course of some people's lives, and they end up having to get some surgeries and replacements to fix the wear and tear on it. Looking at the bony structures, I'm not going to assess over these, but it is good to understand how those bones fit together to allow it to be a hinge joint. So the joint itself is between the tibia and the femur. The fibula is not the proximal end of the fibula doesn't actually reach up into the knee joint, so it's just between the femur and the tibia. And on both the tibia and fibula, you have what's called epicondyles, and these are just little bony prominences that sit out on the side, which are great places for muscle attachment. Same thing holds true for the tibial tuberosity. That if you reach down on your tibia on the proximal end, there's this bony part that sticks out. That's your tibial tuberosity. That is where your quadricep muscles basically tie into your lower leg so you can get knee extension. And it has to be a little bit more bone density there because your quadriceps are a very large group. There's a secondary joint within the knee called the patellofemoral joint. That's where the patella kind of sits over and glides over the femur. It's held in place by the quadricep tendon from above. And then you have your patellar ligament, which extends from the patella down into the tibial tuberosity. Most people just kind of think of it as one big band running down and through. But that's the patellofemoral ligament. And it's stabilized by the contractions of the quadricep muscle group. On the femur, you have your medial and lateral condyles. These are the rockers on the distal end of the femur. They actually look like rockers, and they're made to rock back and forth on top of your tibia. If you look at the top of your tibia, you'll see it's pretty much flat. There's some shallow little grooves, fossas, remember fossas, any sort of depression, that these condyles rock in. They're not very deep. They don't offer a lot of stability, as well as this tiny little bony bump up that's called the intercondyle eminence on the head of the tibia, and it's a little guide, but again, if you look at the overall bony structure of the knee, there's not a lot of support there to keep that knee together. You compare it to the humerus and the ulna of the elbow. I mean, that's another hinge joint. That thing, it's not going anywhere. You look at your ball and socket joints, but like specifically the hip we just studied, the hip, it's really hard to pop out. But this knee, those bones just rest, literally one on top of the other. So here you can just see the distal end of the femur resting on the proximal end of the tibia. There's nothing bony to say, hey, don't fall out. There's a little head of the fibula kind of saying, hello, I'm here. And you got the patella sitting on top of the femur, and again, it will just kind of move in that zone, held in place with the quadricep tendon here, patellar ligament here, and then it doesn't go wiggle, wiggle, wiggle because of the contractions of the quadricep tendon. But this is it. There's no real bony structure that's going to allow for a lot of stability in your knee. Because it does take the brunt of the weight of your body, you've got some cushioning. We got the nice happy articular cartilage here, and then you got these little meniscus, and they kind of act like shock absorbers. They're little C-shaped structures made out of fibrocartilage, and they're going to be like your little tiny shock absorbers and guides for your condyles of your femur. They're bigger on the outside. They kind of shallow and smooth in towards the inside. There's nothing between. They don't fill in. They're just like these little semi-half circle rings, and they're there to kind of just give a little bit of support, not fibrous support to the knee, so that your femur can actually move back and forth on top of the tibia and act as a little bit of a shock absorber. But again, if you look through that, there's just not a lot there to keep them in place, except for ligaments. And count them. I got 1, 2, 3, 4, 5. You got 5 essential ligaments. These are your primary 4 that hold your knee together. That's it. And that's why it's so easy to damage your knee, because you've got essentially 5 ligaments that are going to keep it together. So you have what we call the medial collateral ligament. It's on the tibia side, so it can also be called the tibial collateral ligament, most commonly referred to as the MCL. You have your lateral fibular collateral ligament, so it's on the lateral side, and it's called the LCL. Then you have these two that crisscross within the 2 condyles of the femur. So you have your anterior cruciate ligament and your posterior cruciate ligament. And I'll describe their location and function on the next slide. But this is it. You have your ACL, your PCL, LCL, MCL. And that's it, holding your knee together. I'm going to make you learn it. This is the magic that happens in the knee. You probably know someone who's damaged these ligaments and had to have surgery. No pigment. Remember that ligaments aren't very vascular. Super long recovery time with or without surgery. It's actually about the same. So we're going to look at those here on this slide. So here's the lateral side. I know it's the lateral side because I can see the happy fibula right there saying hello. So the LCL actually connects the femur to the fibula. The MCL connects the femur to the tibia. So I have my medial and lateral side held in place by those meniscus. This stabilizes the knee from going side to side. It keeps it from going this way. It keeps it from going to the medial side. It keeps side to side motion limited. Here I've got the patella deflected so you can see those cruciate ligaments. And I told you that they crisscross in between the condyles of the femur. They prevent forward and backward movement of the knee. So it doesn't pop towards the front anteriorly. It doesn't pop towards the back posteriorly. Medial's got the medial side covered. Lateral's got the lateral side covered. And they're named for where they start. And then they move in the opposite direction. So your anterior cruciate ligament starts on the anterior side of the tibia and then goes to the posterior aspect of the femur. The posterior cruciate ligament starts on the posterior side of the tibia and goes to the anterior part of the femur. And together they prevent forward and backward movement. Here you can see all the ligaments in place. That's what holds your knee together. That's it. That's all there is. You got your strong quadricep muscle group. So you have your quadricep tendon. Here's your patella. Here's your patellar tendon. But really, this is what's holding your knee together. It's not fun. It's not fun at all. That's why you gotta take care of your knee. You plant your foot wrong, you turn your upper torso, and it's easy to tear. Or you take a lateral blow, you're gonna rip out your medial collateral ligament. You take a medial blow, you're gonna rip out your lateral collateral ligament. Get caught twisted upright, and then you just blew out your whole knee. We have movements at the knee. Well, it's a hinge joint, so hey, flexion extension. Ta-da! If you do have the knee flexed, you can do some inward and outward rotation in non-weight bearing positions. You cannot do those in weight bearing positions because you will rip out your ligaments, and then you lose complete stability of the knee. The nice thing about the knee is you already know the muscles that allow for flexion and extension. If you learned them for the hip, you've now know them for the knee because it's opposite land now. If I'm a hip flexor, I am a knee extender. So we're looking at the quadricep group. You know the 4: your rectus femoris, your vastus intermedius, your vastus lateralis, and your vastus medialis. If you know your hip extenders, guess what? You now know your knee flexors. So they work in that opposite land here too. Your hamstring group, your bicep femoris, your semimembranous, and your semitendinous Got your Sartorius and your Gracilis rocking it too. We're familiar with those. We're going to add a couple of new ones. You have your popliteus, and if you reach down to the posterior back of your knee, that's where you're going to find your popliteus. That's actually called your popliteal area. So that little muscle, it's a little muscle, it sits back in there. And then we got your gastrocnemius, which is your calf muscle, and it helps with knee flexion too. If you remember watching the video of the lady lifting, you could see her gastrocnemius engage in the effort of that. That's why, because it helps work with that knee too. So it's going to work with these guys with the flexion portion as well. So I will see if I can get out of here, and I don't see my stop button. There it is. Alright, I'll try to put this up on the blog for you, and I will read off the ankle and foot as well.